course, the Carolinas share a name, but the states are taking two different paths in their reopening as everyone is debating the question, when can we reopen our economies? Thanks for joining us tonight. I'm Scott Wickersham.
I'm Erica Bryant. North Carolina is still only on phase one of its reopening plan, while South Carolina continues to announce the lifting of more and more restrictions. We have team coverage from North and South Carolina, including how well Charlotte's economy could rebound once it does reopen. We want to start in North Carolina, where once again protesters marched in Raleigh demanding that Governor Cooper reopen the state. Now, those protesters frustrated that they still have to wait while other states are opening. Channel 9's Mark Becker is joining us live. Mark, they say that North Carolina's reopening is just far too slow for them.
Yeah, Erica, let's be clear here. We have seen some changes since we officially went into phase one at 5 p.m. on Friday, right? South Park Mall opened up over the weekend, and I've seen a good bit of traffic here today, certainly. But there are people, as you say, who say we simply aren't moving far enough or fast enough. And many of them were out in Raleigh today, back on the streets in front of the Capitol there, pushing for an accelerated opening here in North Carolina. They're looking across the border to South Carolina and beyond that to Georgia, where restaurants and other businesses are already open. And they want the same here. But in a news conference just a couple of hours ago, the governor spoke to their concerns and said North Carolina's metrics are headed in the right direction. But he also said we need a full 14 days from the time we started phase one to make sure that progress is real.
We are pleased at North Carolina's numbers. I think the people of North Carolina deserve a lot of credit for that. But understand that we are now just into phase one. We're only, 4 days into phase one. So we have to make sure that people continue to stay at home as much as possible.
You know, that 14 days isn't something that Governor Cooper just dreamed up. It comes, of course, from that 14 days of quarantine, which is standard if someone is exposed to the coronavirus. Now, having said that, he's also getting some political pressure from Raleigh to move things along faster and farther. We'll have a little bit more on who's saying what coming up on Eyewitness News at 6, along with the governor's response. Erica? Scott?
All right, Mark, thanks very much. We'll look forward to that report coming up at 6 o'clock.
Again, as we've mentioned, South Carolina has already been moving through its reopening phases, and just yesterday, restaurants there were allowed to open up with indoor dining. But just because they can open does not mean that every restaurant owner is comfortable doing that. South Carolina Bureau reporter Greg Suskin talked to people at two restaurants. One said eating inside their restaurant would not be safe for them right now. Greg.
Yeah, that's right. And I also just took a walk down Cherry Road, about half a mile down that way, where a lot of the fast food restaurants are. None of their dining rooms are open. In fact, most will have the lights out and chairs up on top of tables. So I think we're going to see something like we saw with retail stores. This opening is going to be gradual. Captain Steve's Seafood is a landmark in Fort Mill, but no one's been able to eat here for almost 2 months.
At first, we were kind of, scared to tell you the truth because we didn't know what to expect.
Owner Steve Mantikas had to lay off half his staff of 60 and kept the rest on for takeout. For now, he'll leave this sign up out front and will be open only for takeout. In a place that seats 500 people, he's too concerned about the risk of spreading the virus and says it's not practical to open at 50% capacity.
How are you going to handle that situation? You're going to have to turn people away. People will be getting upset. Now they come and place their order, pick it up, and they go home and enjoy their meal.
Last night, he posted on Facebook letting customers know the dining room will stay closed until further notice. The Pump House on the Catawba River in Rock Hill is taking a different approach.
We took basically about half the tables out of the dining room.
General Manager Chris Johnson will reopen the Pump House tomorrow night. The tables are now spaced out at least 6 feet, and they're changing the way they let people in to wait for seating.
From our perspective, if I don't have a chair to put you into, I'm not going to let you in the building.
Many restaurants will reopen in the next few days once they train staff on all kinds of new procedures and changes. Johnson wants guests to feel comfortable and safe, and the fact that they've already booked more than 80 reservations for tomorrow shows customers are ready. Still, it's anything but business as usual.
Excited to be getting back to some sense of normalcy, but also a little bit nervous about about how it's all going to unfold.
And when the Pump House does open tomorrow night, its servers will be wearing masks. They talked about getting them to wear gloves as well, but then realized they'll be throwing away hundreds of pairs of gloves every night. These are just some of the issues that restaurants have to deal with and talk to their employees about before they reopen. Erica?
Yeah, kind of each person and each business as they feel comfortable. Thank you, Greg. If restaurants do want to open up, they will need to follow some strict guidelines. Here's a look. They can only be at 50% capacity. Tables and chairs need to be 6 to 8 feet apart at least. And employees need to have health checks, temperature checks included. Next week, even more businesses are going to be allowed to open after an announcement from the governor in South Carolina yesterday. Starting on Monday, gyms and fitness centers, public pools, and all types of salons will be free to reopen. The governor urging them, though, to follow the guidelines from DHEC, which include a long list of safety practices.
New data from Mecklenburg County shows encouraging signs as people look further toward a full reopening. The county says in the last 2 weeks, hospitalizations from the virus are down. The data shows 7% of those who were tested came back positive, so that's a slight decrease. It does say more people have been out and not social distancing as much, but overall things still much better than before the stay-at-home order went into effect back in March. When the area does reopen, what about the Charlotte economy? When will we rebound? How long will it take? The president and CEO of the Federal Reserve Bank in Richmond broke down what he thinks that will look like. Our Blaine Tollison learned we could be in better shape, though, than other cities.
When it comes to opinions on the economy, how about one from a president and CEO with the Federal Reserve? While he did give local businesses some grim news today, he's also putting stock in Charlotte, saying the city is well positioned for a strong recovery. The look and feel of a mall store. Many are cleaner than ever and eager for shoppers. They trickled into the North Lake Belk today, where before the pandemic, it wasn't unheard of for the store to see more than 10,000 customers in a day.
Well, I think that the best thing anyone can bring into Belk or in anywhere right now is patience.
Success in this time will depend on consumer confidence. That is key to recovery, according to Tom Barkin, the CEO and president of the Federal Reserve Bank of Richmond, which includes the Charlotte branch.
They need a story that'll convince them it's okay to shop or to travel or to go to a restaurant again.
Barkin told area business leaders on Zoom this morning that they need more practical health guidance from state and local governments. Right now, he says blue-collar workers are most at risk of getting COVID-19, with only a fifth of the workforce able to work from home, compared to 63% of white-collar workers. He says blue-collar families will help drive the economy.
I'm hearing from some lower-end retailers that they actually see them engaging in commerce more freely.
But no matter who you are, working in the Charlotte region during a recovery is a good thing.
Charlotte is a great market and a great economy, and I think Charlotte is very well positioned for this.
Barkin said that we are in the end of a mass economic shutdown, which he believes will last about a couple of months, maybe even more, but the recovery from all of this is going to take much, much longer. Back to you.
Well, local businesses are being cautious about when to allow their workers to come back to the office. The Employers Association surveyed about 150 companies all around the area. Many of them plan to wait until at least June to end their remote work policy. And when workers do start coming back, here are the top 3 things they're going to do to try to protect them. They're going to be sanitizing more. They want to limit office contact, and they're going to have to reconfigure their workspaces to keep people far enough apart from each other.
Today, the new numbers of coronavirus cases in North Carolina remained lower than we've seen over the past several days. There were just over 300 reported today compared to 400 or 500 recently. But the state did report out 27 new deaths today. There have been 577 people who've lost their lives so far.
In South Carolina, reporting 9 new deaths today. There are also 135 new cases. That's just about the same as they had yesterday. 16 of those new cases are in York County.
Senior year of high school. You have prom, you have graduation, but this year things are obviously different. Tonight, the CMS superintendent is expected to announce what upcoming graduations will look like. Education reporter Elsa Gillis is joining us live. Elsa, they asked for seniors to give their thoughts about this.
They did, Erica. And you know, this is a really difficult situation for all seniors, not what anyone wants. I do know families are really anxious for some answers, though, about how this will work. It's a challenging situation as safety, health, and equity have to be top of mind. Graduations begin as early as next week. There are 31 in total, and a graduation task force member shared with me that the conditions have to be the same for all. CMS set up a task force with parents, students, and staff to discuss alternative graduation plans. They invited feedback from the community to discuss, and then the district put out a survey over the weekend asking seniors to weigh in on 3 options. Each option includes a pre-recorded virtual ceremony along with one of the following: a celebratory scheduled drive-through event, and then students would pick up their diplomas at a CMS high school, diplomas mailed to each student after the virtual ceremony, or diplomas mailed to each student after the virtual ceremony and a future school-based celebration. Now, tonight's virtual board meeting will be streamed on the CMS Facebook page. That starts at 6 o'clock. I did see that this item is pretty early on in the agenda, so we should have some answers in the next hour or so. Erica, back to you.
Thank you, Elsa.
Well, the question a lot of parents have, of course, is when exactly will my children go back to school? The bigger question, what will school look like? How many days will they go? And what will classes look like?
Yeah, and today the nation's top infectious disease doctor talked about this very topic, saying that there's really no easy answer, as you can imagine. Dr. Anthony Fauci was among the top doctors testifying before the Senate Health Committee today. He says it is hard to come up with one single game plan because the country, of course, is so big, not to mention the dynamics are different in each state, each region. He was asked about the risks and the benefits of sending our children back to school or having them miss out on in-person education.
Obviously, very difficult, of the unintended consequences of trying to do something that broadly is important for the public health and the risk of having a return or a resurgence of an outbreak, and the unintended deleterious consequences of having children out of school.
Now, Dr. Fauci says the plan to send kids back to school will have to encompass many things, from how to deal with an outbreak to how we make the children feel safe inside their classrooms.